This is the column that I wanted to read to you. This is something that should draw your attention like nothing else, and I don't even know if there's anything we can do about it at this point. It's by our buddy Tony Blankley, townhall.com. I want you to listen to what we are in for. I want to tell you 52% drones how disgusted I am with you. And by the way, as I speak here right now, the Milhouse team is plotting to put thousands and thousands of their leftists at all levels of government. You won't recognize your government by the time this is over. With the regulations they're going to issue, with the police powers they're going to use, with the change in policies, with the way they're going to twist the Constitution and load up the Supreme Court and the bureaucracy, you ain't seen nothing yet. And it's going to be big and it's going to be bad. Now, this quiet little man called Tom Daschle, who is a detestable Senate Majority Leader and Minority Leader, vicious little backstabber, well, now he's going to be the health care czar, and he's going to run the Department of Health and Human Services. He's going to have that quiet voice, really, his quiet voice, while he is destroying the health care system. Here's what Tony Blankley writes. I hope you're listening. Put up the volume and call everybody around. This is critical. As President-elect Obama's apparent choice for Health and Human Services Secretary and his White House health care czar, it is a fair guess that Tom Daschle's view on health care legislation may be decisive. So it's worth reading his book, Critical, What We Can Do About the Health Care Crisis, in which the gracious former Senate leader lays out without equivocation both the policy he recommends and the tactics for how to pass it. Ladies and gentlemen, this is just the tip of the iceberg. He proposes setting up a board to establish standards for health care delivery in the United States that would be modeled on how the Federal Reserve Board and Securities and Exchange Commission oversee banks and corporations. Technically, it would only oversee the public health systems, Medicare, Medicaid, VHA, etc., which provide about 32% of the health care nationwide. On page 179, Daschle writes in his book, quote, the Federal Health Board would not be a regulatory agency, but its recommendations would have teeth because all federal health programs would have to abide by them. So here we will have some kind of health care Politburo, manned by who the hell knows whom, dictating policy for all the federal health care programs. And more. Hold on, here's the catcher. Although his board technically would have no say on the 68% of health care that is provided through the private sector, at the bottom of page 179 of his book, Daschle modestly adds the following, quote, Congress could opt to go further with the board's recommendations. It could, for example, link tax exclusion for health insurance to insurance that complies with the board's recommendation, unquote. Those last 19 words would spell the end of independent private sector health care in America. Obviously, no health insurance could be sold if it were denied the tax deduction. Now, you get health care from your employer, for instance, it's not taxed. He's saying it would be to your employer and maybe to you as a way of forcing you and your employer and your insurance to comply with government dictates. Do you understand that? Every policy, every standard decided by this board would be the law of the land for every drug company, every hospital, every doctor, and every health insurance company. Indeed, 20 pages later, Blankley writes, in the section in which he identifies losers under his plan, Daschle is admirably candid. Among the explicit losers, he includes doctors and patients might resent any encroachment on their ability to choose certain treatments, even if they are expensive or ineffectual compared to alternatives. Some insurers might object to new rules that restrict their coverage decisions, and the healthcare industry would have to reconsider its business plan. All that propaganda, all the millions of dollars spent on lies by Obama on his commercials. Well, we'll have a private system, public. You'll get to keep what you have and do what you... No, you won't. No, you won't, suckers. So that is to say they can stay in business and deliver their services, but only as the government bureaucrats say they may. They no longer would be genuinely independent. Sort of like the automobile industry, sort of like the oil industry and the steel industry, sort of like the textile industry, all under the iron fist of the federal government. Yep, that's what you're in for. One of the things that Daschle says will have to change is the, quote, technology arms race, unquote. He claims hospitals are engaging in to attract aging baby boomers with the latest diagnostic imaging machines. Listen to this. Imagine that, offering customers the latest technology, which, as Daschle admits on page 125, quote, helps doctors estimate the spread of cancer or the extent of cardiac disease without surgery. Of course, though, for Daschle, the problem with such high-tech diagnostics is that it leads to treatment. On pages 123 and 124 of his book, he cites a study approvingly for the proposition that there are too many angiograms being performed. By too many, he specifically cites a study of 828 angioplasties, in which only a third were likely to benefit the patients. Another half might or might not, and 14% were not likely. Now, I might conclude that if 85% of the patients receiving the treatment might benefit, the one-third who definitely would and the 50% who might, and if I were one of them, I might want the procedure. But for Daschle, that would be a waste of money. And, quote, the imaging test that shows narrowing of the arteries was to blame for the excess treatment. I've had 8 angioplasties, some with catheterizations. Maybe I should have had 4, 3, 6? I don't know. What would Daschle say in his board? Then blankly writes, what followed is my favorite line in the book. Quote, when the test revealed a narrowing of the artery, however slight, cardiologists couldn't resist doing something about it, unquote. Imagine a doctor trying to actually cure his patient. Cardiologists may have thought they were carrying out their responsibilities, but under the Daschle plan, political hacks appointed to the health board will decide whether your cardiologist is allowed to image your arteries, and if they find blockage, try to treat it successfully. And ladies and gentlemen, that's just one part of the body. We can move to the kidneys. We can move to the liver. And we can move to the brain. Some of you, we can move to the sphincter. But you get the point. But that is not all Daschle doesn't like about private sector health care. On page 174, he points out the dangers of letting drug companies advertise their products to the public. He says the public may want the drugs even if some Washington bureaucrat likes another drug instead. He believes that Americans are not entitled to just any care that might do some good. Yep, page 122, quote, many patients with insurance want any care that might do some good, and plenty of doctors will oblige them, unquote. Oh, God, I hope you're listening. Recognizing that some of these ideas may not be vastly popular, Daschle recommends 2 basic legislative strategies. First, seek to pass the legislation early in the first year of the president's first term when he is most popular and is least likely to be resisted. That is a valid analysis. Ladies and gentlemen, that, I think, is one of the things they're going to rush through in January as fast as they can. The destruction of our healthcare system. The other strategy, Blankley says, which is very smart, is to leave the nasty details out of the bill. He says that was one of Clinton's mistakes in 1993. Clinton put too many details in the bill, thus alerting those who disagreed to mount an opposition. Pages 108 and 109. Daschle recommends passing a vague bill, and then, quote, a federal health board should be charged with establishing the system's framework and filling in most of the details. This independent board would be insulated from political pressure. Do you believe this? I mean, I keep saying it. We would trade America's healthcare system for an old Soviet-style healthcare system? By political pressure, he means the democratic process of electing fellow citizens to Congress, who then pass legislation about which the public is informed before the final passage, and about which they may wish to petition their government for redress or grievances. Apparently, we can end petty bickering and partisanship by not letting anyone know what the new laws will contain. Oh, boy, I tell you. He's a centrist. Look at all the wonderful centrists he's appointed, like Tom Daschle. He's a centrist. Centrist? He's an a-hole, an apple hole. That's right, he's an apple hole. Tom Daschle, man from South Dakota, man who has spent most of his life in Congress and is a lobbyist, whose wife is a big-time lobbyist. He's going to develop. He's going to be the great philosopher king who's going to set up the healthcare system with this board, this Politburo, that's going to make all these decisions. And if you don't like it, you can always leave. I mean, after all, there's enough illegal aliens to replace you.